Hello.
There's a big record button
Nabil.
there.
Yeah, it's recording now.
It's
It's
admitted.
recording.
Alhamdulillah. Wassalatu wassalamu ala Rasulillah. Welcome everyone to our Save One Save Humanity 6th class, Environmental Emergencies and Poisoning. Really glad to see all of you again. It's myself, Nabil Abdurrahim, and my colleagues Zishan and Nudin with us today. So we continue our journey in this course. We've completed 3 sessions of BLS, 2 sessions of BTLS, and now we are having a day for environmental emergencies and poisoning. As always, we shall start with the ayah of the Quran. The reason that we established this course is from Surah Al-Ma'idah. وَمَنْ أَحْيَاهَا كَفَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved the entire mankind. And also the Prophet ﷺ said, whoever alleviates the hardship of someone in distress, Allah will alleviate his hardship in the worldly life and the hereafter. So this is the basic reason that we are conducting this course, so that we get to help others and we know the right methods and the right techniques to help someone in distress. So this course is made of 3 parts. As I mentioned earlier, we have completed the basic life support, we've completed basic trauma life support, and bi'idhnillah, we will complete the environmental emergencies and poisoning today. So today's objectives are going to be a quick recap of BTLS and just a brief mention about finger amputation and dental avulsions. And then I will leave the floor to Dr. Zishan and Dr. Nudin to present on drowning, heat stroke and frostbite, bites and stings, common household poisonings. So I will not be going into detail about this. So last 2 classes have been, we've been discussing about this in detail, about how to manage a trauma case, how to manage an accident, and all the details and the videos present from the previous class. So as we discussed, our goal is going to be A, B, C, D, E. When you see an accident happening, when you see a trauma in front of you, the immediate thing that you have to do is to stabilize the airway with C-spine. Even before that, as the slide mentions, if there is any catastrophic hemorrhage, like there is severe bleeding that is obviously happening, like someone's legs been amputated or someone's arms been amputated, or there is lots of bleeding, okay, that you can actually see from the person, then immediately try to control it. And we have told you how to do that, how to apply tourniquet. The next thing, to stabilize the airway with C-spine, we've mentioned that as well, how to do that, give jaw thrust and breathing and ventilation. There's nothing much that we can do immediately, but if you have oxygen, that's the best thing to give at that point. And bleeding, how to control compression, tourniquet, and head injury. And we discussed those things in the last class. So I will ask all of you who've not seen those videos to go back and revise from those slides and videos. That'll be really useful for you to get a grasp of how to do a primary survey. So coming to just 2 small topics, continuing those trauma topics, I want to talk about finger amputation. Sometimes it does happen that we do find people coming from industrial areas or even at home sometimes that they're using some machinery, some circular saws or something that they're using. And suddenly you would see someone's fingers being chopped off, or someone is using a big knife in a butcher shop or something, and by mistake they cut their finger and the finger is his finger is completely detached. Okay, it's called amputation. So if it's a complete amputation, like how you're seeing in the picture here, the first thing you need to do is, to just give a quick wash to the amputated part, wrap it up in a small cloth, okay, ideally a gauze, but if you don't have a gauze, okay, clean kerchief or something, just wrap it up. And then you put that wrapped part, the finger within the wrap part, into a bag. And then take that bag and place it in a bigger bag, which is ideally filled with some ice. And this is how you transport amputated part. Okay, so if your finger is chopped off, first thing is to wash off, wrap it up in a cloth, put that in a bag, and then put that bag into a bigger bag. The reason we are stressing on this is that, I remember when I was working in Global Hospital in Chennai, I've had a person bringing an amputated part of someone's finger, okay, and they wanted to help, obviously, but what they did was they put the finger directly onto the ice and they brought it. Okay, so if you put this finger piece, okay, directly onto the ice, okay, what happens is that ice on direct contact with your finger will actually have a negative effect, okay, and it might destroy a lot of your tissue, and it damages the tissue in your finger of the amputated part. So that is not a good thing to do. Do not put the finger directly on the ice. That's why we're mentioning to wrap it up, put it in a cover, put that cover on the ice bag, so that it remains cool, but not too cool that you directly damage the tissue. So that's how we transport a amputated finger. And even amputated parts of your arm or hand, if it's completely broken or amputated completely off your body, okay, that can be saved. And there are many specialists nowadays who are available, who are hand specialists, plastic surgeons, and it's much more advanced than what it was before, and they can fix things back, okay, if taken back in the right manner at the right time. So for example, this person's hand, the forearm, the distal part of the forearm was completely chopped off by someone. So they've fixed it beautifully here. And in a few years' time, he's also regained the strength and he's able to do things now with that arm. The next topic was to discuss about a tooth. Okay, and sometimes it happens that either someone's punched you on the face or you've fallen down, you knocked your tooth out of your mouth. Okay, mostly it's always a front tooth, but sometimes can happen that your back tooth can also come out. But it's very rare that your back tooth or other tooths come out, because they're much more stronger than your front tooth. So let's say your tooth falls out. What you can save your tooth. Okay, so tooth which has come out, this is a permanent tooth. I'm not talking about a child. A child, if they're if they're still having their initial tooth, that's fine, it'll grow back, but since at least you'll have a new tooth from that socket. But as an adult, if this is your permanent tooth, if you want to save it, you can do it. All you need to do is once the tooth falls out, hold the tooth by its crown, as you can see in this picture, in picture 2. Okay, hold it by the crown, not by the root. The root is the tip. Don't hold it by the crown, and give it a gentle wash with milk if it's dirty. Okay, or you can even use water. So you use milk or saline solution or cold running water, not too fast, slow running water. The reason for milk is because milk has calcium and it is good, okay, for the tooth. So you can wash it with milk. Then the best thing to do is to put the tooth back into the socket, where into your mouth. Okay, so just give a gentle wash and put it back in the place where it fell from. Okay, and obviously it's not going to stay there completely. Okay, so you have to push it in and then hold it with a kerchief if possible, or any cloth piece. Then hold it there and then go to the dentist immediately. This is a dental emergency. Okay, so keep the tooth back in from the socket where it fell and go to the dentist. If you think that is not possible, okay, and the person is unconscious, or let's say it's not safe to keep it in the socket, you're not able to put it in, you can transport it by carrying it in a container with milk. Okay, all you need to just take a cup of milk and then put the tooth into that. Okay, soak the tooth into that, just let the tooth fall inside and take that to the dentist. Usually this should be done, the best outcome is within an hour. You can do it it's been done in 2-3 hours as well. But the sooner you go, the greater the chance that the tooth can be restored. And what they do is they usually attach it back and they implant, they reimplant, and then they put a splint, a flexible splint that keeps it in place for some time till the root actually, reestablishes itself in the socket. Things start growing back inside, and it becomes stronger. So till then, they keep the splint. And with that, I'll stop, with my initial two topics. So we are now entering into environmental emergencies and poisoning. Okay, this is something which we wanted to mainly focus on today. Lots of different poisonings are out there, a lot of different emergencies that can happen from the environment around us. We have tried to consolidate as much as we can. Okay, I hope it's beneficial. And towards the end, we have question and answer session, and inshallah, you can ask as many questions as you want. We will discuss about it. If you missed anything, you can ask about that as well. So I will ask first Dr. Zishan to start his session on environmental emergencies, and we'll start that with drowning. So I'll stop sharing now. I'll ask Dr. Zishan to step in.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. So my topic for today is drowning. Three topics actually: drowning, heat stroke, and frostbite. These are simple topics, but I've just tried to make it as simple as possible. And so it's a bit long, but I've still made it easy for the sake of understanding. So the first topic I'll have to talk about is drowning. So what is drowning? Drowning means, according to WHO, drowning means a process by which a person, his respiratory, his breathing center does not work after he has been submerged in a liquid, any liquid, water or any kind of liquid. And after this, because of his breathing problems, he might be dead, or he might have some permanent medical problems or no medical problems. All right. So according to WHO, drowning is the third leading cause of unintentional injury worldwide. Imagine that's 7% of all injury-related deaths. There are around 3,20,000 deaths worldwide. And among this, the most common are children, males, and individuals who are more easy access to water. Okay. So what factors influence drowning? Quickly, I'll go through them. You can read them in detail later on, but most commonly, the first one obviously is lack of swimming ability. All right, lack of swimming ability, lack of barriers, lack of close supervision, what location they go in, failure to wear life jackets. It's very important people don't wear life jackets. That can also cause problems. Other one is alcohol use. So people who use alcohol, I know it's not common in our communities, but in other countries, alcohol use can cause, it affects your ability to breathe and make decisions. That's what causes problems in swimming. Okay. The next thing is seizure disorders. What can happen?
1 second, Dr. Zishan, just hold on. Someone is annotating the screen now. 1 second.
Oh,
So
yes.
kindly don't annotate on the screen, please. This is request, because then we can't see what the presenter is showing. Fine. Yeah, I can continue now.
And I don't know why people are doing this, because I don't think they should be doing this. It's wrong. Because while I'm teaching, they shouldn't be doing this on the screen. Because it blocks the screen and people cannot see. Okay. So the next thing, what I was talking about is alcohol use, seizure disorders. So seizure disorder, the problem with seizure disorders is it can affect a person's. If a person has a seizure while he's in water, they'll become unconscious, and that itself can cause them to inhale water. It can go in the lungs, and they'll die obviously. The simple things, locations. What locations can you think of when you think who are the people who can where are the locations that you can drown. In Western countries, okay, we know most commonly swimming pools, beaches, but when you think of India, there are a lot of places in India where, even if you are not in a seaside area, you can still have enough areas where there can be accidental drowning. Ponds, lakes, see farmlands, they put so much of water. Imagine a small child running here, can slip and fall. Rivers, you know, people, kids play in rivers, even so many videos you'll find online in Indian families that went to a river and then they drowned, because of a fast flow of the water. Uh, Near your homes, very, very important swimming pools, bathtub. Sometimes parents leave the kids in bathtub to play and they might forget and they might not come back and, some accidents can happen. Swimming pools that do not have a barrier, it can happen there as well. Kids are playing, I know there's a relative who passed away because uh, the son went and drowned in you know, the relative son drowned in the swimming pool because some similar thing like this. There was no proper barrier. Potholes, wells. Kids like to play in wells, especially in towns and villages. Kids will go and play in wells, and if you don't know how to swim, it's dangerous. Potholes. Look at that potholes. Imagine if you were going on that pothole with a family, or you might think it's a small pothole, and if a truck itself can fall in, imagine what happens if a small child falls in. Children are the most at risk here. Beaches, waterfalls. Now look at the waterfall. The way people are playing over there. One slip, you fall in the waterfall. You hurt your head. You become unconscious. That can cause. That can be very dangerous. All right. Beaches. Yes, beaches are also important. Uh, People go there normally. This is Marina Beach. People, this really it's one of the largest beaches in India. We see a lot of accidents happening there in Chennai. Now, one thing about Marina Beach I remember was, uh, hold on, Nabil, are you able to see it in full screen now?
No, it's still in
Hello?
the double slide mode. No.
How did this happen? Hold on, let me see. What about now?
No, it's still the same. Yeah, it's okay now. It's fine now. Yeah.
Now it's full screen, is it?
Yeah.
Okay, fine.
Yeah.
So one thing about beaches, specifically, what I wanted to say was this is something I came across while I was uh, researching for this topic. In beaches, the most common causes of death in a beach is something called a rip current. Now, what happens is often when there is a flow of wave coming towards the beach, it might hit us. There might be sandbars there, and a sandbar might have a gap in between. What happens is when the waves hit the land, they turn back and they go outside like this towards the ocean again. And this is a very strong outgoing current. Now imagine if you're swimming here, you will not feel much. But sometimes what happens is some people come out into the strong rip current and this pushes them outwards towards the ocean. And this is very difficult to swim against if you're stuck in this current. And it seems apparently in sea, the biggest number of deaths that happens in sea is because of a rip current. So that's very important. All right. If you look in a, it's if you look at it with time, I realize that you can learn how to recognize a rip current. Basically, what happens is in this photo you can see areas that do not have enough waves. That might be an area of a rip current, and you see how the water is going back towards here. That's a rip current. This is a rip current here. Now look at this gap here as well, this red arrow here. Imagine if you're sleeping, if you're swimming over here and you get pulled out to this area, you will just get pushed away into the ocean. How do you escape from this? It's very simple. If you are ever, it's like you're on a treadmill. If you go against the treadmill, you'll get tired. But if you go along with the treadmill, you'll just get pushed outwards. Simple thing is, if you are ever in the ocean and you get pulled out by a rip current, just go left or right, swim towards left or right, and you'll easily come out into the normal area. If you're still getting pulled outwards, just relax till you come out to a big distance. And once you're in the distance where it has slowed down, then swim away. All right. Call for help while you can. Okay. Swim out of the current to and then come back to the shore. This is an easier diagram. Here again, if you're getting pulled out, go left or right. If you still cannot swim out in that way, then just go along with the current till you reach beyond this current, and then you swim outwards and towards the ocean again. All right. So what can we do to avoid this? To save ourselves from drowning. All right. Well, the most easiest answer is swimming skills. Learn swimming skills as soon as you can. Whenever, if possible, teach your children. Children 1 to 4 years have the highest risk of drowning. Teach them from that young age. Swimming is something like walking or riding a cycle. Once you learn it, it will not go away. Your body learns to swim no matter what. Okay. So once you have learned it, so it's a skill that you need to learn, and it's not that hard. Few months, I think when I learned swimming, I just went for 1 or 2 months, and that was enough. So obviously, from a young age, you teach kids. It's a very good skill. That's one thing, swimming skills. Second is CPR. Okay, learn CPR, and this is what the whole aim of this class has been, to teach people how to do CPR. Now, if you see someone who's drowned, bring them out back to the shore. And if they're unconscious, if they're in cardiac arrest, they're not breathing, there's no pulse, start doing CPR once you brought them back to the beach. Another important thing is people who can't swim, kids who can't swim, give them life jackets, please. A proper life jacket. That is very, very useful. Some more tips. You can read this in detail. Remember, if you have a child or someone who can't swim, always be around them. All right. Adults need to concentrate. They cannot be doing something else because drowning is a very quick process. 2 or 3 minutes, someone can get unconscious and even die. So you have to be there present all the time. Use a buddy system. Always get someone along with you who can swim. And if you have seizure problems, please don't be in the bathtub alone. Don't leave kids in the bathtub alone. Don't send them to swim alone. I've seen a patient who got a seizure while he was in water. He drowned and he got permanent brain damage. They could not do anything. He was a young man, no problems. But one seizure made him to have permanent brain damage, and he eventually died because they could not do anything else because he had a seizure while he was swimming. It was very unexpected. Kids should have life jackets. The small tubes and wings and things that they wear, those are not proper life jackets. They're helpful to keep them afloat, but they're not proper safety devices. People should not take alcohol before swimming at all. It's very dangerous. And of course, your weather conditions. Don't go out to the ocean or waterfalls or river, please, if there is a bad weather. I have seen this itself when I had gone with Nabil and all to a waterfall place. How quickly a weather change can make the water flow very dangerous. One very, very important point that I wanted to say was, especially in cold climates, when someone falls in water, or if there have been water for a long time, there's something called hypothermia. That is, if your temperature drops below 35 degrees. So if you're in a very cold country or cold climate, if someone drowns in water, remember they might be having low temperature as well, plus the lungs would have been affected. So the most important part of CPR, what we've been teaching is, in these people, check the pulse for at least 1 minute. If it's warm water, bathtub, if it just happened few minutes in front of you, okay, fine. Check pulse 10 seconds and start CPR if there's no pulse. But if it's a very cold climate, then at least check the pulse for 1 minute and then start doing the CPR if the heartbeat is very, very low. Okay. So what will you do first? So if somebody is unconscious floating in water, go to them, See if they're responsive. If they're not responsive, check the pulse. If it's a cold water, check the pulse for 1 minute. If they are floating, or if you have a floating device, then you can attempt to give them breath while they're still floating. All right. If if they're not floating, then you can bring them to the beach and then you can give them CPR. All right. Remember, scene safety. You have to bring them to an area of safety. Don't do everything in water if you're not an expert. Bring them out to the safe area and then do the CPR. Okay. And of course, while you're doing CPR, remember the compression 30 is to 2, 30 compressions, 2 breath, give 100 compressions, all right, per minute. Get the AED. We talked about AED. Put the AED one on the right side, one on the left side. Use a machine. If a person starts breathing after all of this, then you can use put them in recovery position. So the water they'll cough and the water and all will come out. Okay. So the next topic is heat stroke. Now this is something that's opposite with opposite of a cold climate and all those things. Too much of heat. What is heat stroke? This is a condition where too much of overheating of your body, because you're in the hot sun for a long area. If your temperature rises above 40 degrees, your body might have a reaction called heat stroke. All right. Heat stroke is very dangerous. It can affect your kidney, liver, brain. It can cause people to go into coma. They can even die of this heat stroke. Remember, especially in hot climates, like if you're living in the Middle East or if you're living in South India, Chennai, those areas, it can get very hot during summer. All right. What are the symptoms? Remember, of heat stroke, one of the few first symptoms is you'll keep on feeling unwell even after you're in a cool place, you're drinking water. Your body becomes so hot, there's not enough sweat coming out. You're getting very breathless. So a person starts looking confused. A person might have seizure. That's the biggest sign. Or they might become unconscious. If this happens, that's heat stroke. What can you do while you're around them? While you're around them, take them to a cool place. Remember, heat stroke, you have to cool the body. Okay. Give them a lot of cold water, rehydration drinks, cool their skin, put water spray or sponge around the heat sensitive areas, neck, armpit. Keep on doing this till they start feeling better. And if they don't get better, you have to go to the hospital. All right. This is just a small, in image that makes it much more easier. Remember, heat exhaustion happens to a lot of people. You get muscle cramps, you start feeling dizzy, you might, start feeling sweaty a lot. Um, cold, clammy skin. That's one of the signs that's happening. Okay. Heat stroke, if that happens, headache, becoming unconscious, no more sweating, skin is very, very hot. If this happens, you need to call the ambulance, take them to the hospital. All right. Okay. Next one is frostbite. Now, again, this is the opposite of heat. What happens in frostbite is there is damage to the skin and tissue if there is a lot of exposure to cold skin that is less than minus 0.5 degrees. Okay. Anything that goes below 0 degrees, remember, you should be careful. Happens in cold areas. In India, it might be in, the mountainous areas, Western countries, European countries, very common. So the common symptom is it happens in 3 stages. First is frostnip, superficial frostbite, then deep frostbite. Remember, frostnip and superficial frostbite, you can still reverse the condition. If you make them warm enough, the body tissues will come back. But the last stage, severe frostbite, your skin tissues will start dying. You can't do anything more. That part has to be cut off. All right. So frostnip is very mild. Now, like, this photo will help you. Frostnip, basically what happens is you'll feel little bit of numbness. You might feel a bit of warm pins and needles sensation in your skin. All right. Superficial frostbite, what happens is your skin starts going pale and white. And now you will start feeling, some burning sensation in your skin. All right. You can even start seeing blisters, like how it happens when people get burned, like that. All right. Now look at this. First 2 steps, it'll start getting pale and white. Second step, it'll get more numb. They'll not be able to feel anything. They'll start getting blisters. The last stage is where the skin starts dying. The fingers will start going dark. All right. Again, in simplified form, if all of this happens to you if you're in a cold area, cold skin, prickling feeling, numbness, skin starts getting bruised, yeah, bluish white skin, it starts becoming waxy. If your joint starts becoming very stiff, you're not able to move. All right, then you have to get out of the area, go to a warm place. This very commonly happens in your distal areas that are exposed: fingertips, nose, toes, ears, cheeks, chin. This is very common there. All right. Now look at this. You'll think that this person got a burnt finger. No, he does not have a burn. This has happened to a person being exposed to too long, very severe cold temperatures. Now see, you can see all the stages in these photos itself. See, the fingers is going. Look at his toes. They're getting dark brown, bruised. Look at the finger. They're getting blisters. And the last stage, look what happened to the toes. They became completely black. See that man's nose. Nose has gone black. Skin is gone black. In these cases, these part have to be removed because they're dead, and they need plastic surgery treatment for that. That's how severe this disease is, especially if you're in a cold area. First aid, what all can you do? Remember, move to a warmer place as soon as possible. Don't walk further. If your feet and toes are getting frostbite, you will do more damage. Take off the wet, cold clothing. Start wearing soft, dry clothing to prevent further heat loss. Okay. Warm the body by putting blankets. Protect the areas that have frostbite. Don't rub those areas. You'll do more damage. Just give them gentle warmth. Okay. And of course, people should not smoke if they're getting frostbite because smoking affects the oxygen supply to these areas. Okay. So that's the end of the topic. We've covered three topics: drowning, heat stroke, and frostbite. Okay. These are some of the resources that I've used for this topic. We'll put up this link to you later on as well. In the slides, you can see these are very good resource for all disease conditions. You have any medical doubts, please use these websites to check about your medical doubts. People search these things on Google and they are often misled to wrong websites. Use these websites. These are official, good government and medical websites that are very useful for layman people. The last website has very good posters and pictures of how you should manage these conditions we've been speaking about for past few weeks, like cardiac arrest, choking. Those all everything is covered in the last link. Okay, so I hope that was useful. I'm sorry we had to cover things in a short time, and inshallah we'll try to answer more questions in the question answer session. Okay, Assalamu alaikum.
Barakallah fiqh. Yeah, Jazakallah khair, Dr. Zishan. It's a very good session. And especially those resources, like Dr. Zishan mentioned, are very useful, especially the nhs.uk. If you go there, many of these conditions, day-to-day conditions, are summarized in a very simple format. I was just thinking when you're showing about drowning in his advice on swimming, okay, and as Muslims, we are advised, okay, by the Prophet sallallahu alaihi wasallam. But there is a hadith in Sunan Nasai, which is authenticated by Sheikh Al-Albani, that a man learning to swim is not considered a waste of time. Okay, so it's just a summary of it. I'm just telling a small part of the hadith. So it's something encouraged in Islam that you learn to swim. And I personally was inspired, okay, by a story from my own mother, where I hail from. I come from the southernmost part of Tamil Nadu, Kanyakumari district, and there are some rough beaches there. And my mother once saved someone's life in those rough beaches, okay, who was drowning in the sea, and because she was good at swimming and she was able to do that. So that was an inspiration for me. So I think we all should be learning that, inshallah. Also about when you mentioned about heat stroke, I remembered that this can happen even when someone is running really fast and who is really exhausted. And we've seen some people like that who became completely confused because of running and then the body becoming overheated. So the key point in that is to just cool them, keep cooling the person as much as possible. And I saw myself that the more we kept cooling and bringing his temperature back to normal, he started making more sense. He was not confused anymore. So fine, without ado, I will invite now Dr. Nudeen to present to us about poisonings and bites and stings. So Dr. Nudeen, you can join now. You can share the screen with us.
Assalamu alaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Can you hear me, Nabil?
Yes, welcome. Assalamu alaikum.
Yeah.
Yes, we can hear you.
Can you see
nice
my
and clear.
slides?
We can see your slide. It's in full
Okay.
screen. Yeah, can continue.
That's fine. So the first topic for today is bites and stings. So in this, we'll be seeing about various animals and insect bites, what we can do at home, what all bites can be managed at home, what all bites that needs to go to the hospital immediately and it can be treated in the hospital. So bites and stings are very common, especially during the winter and rainy season. So what are symptoms they can present with? It can be as simple as just a lump or itching or like redness in here in the hands. Sometimes it can be very serious as like an anaphylaxis, which we saw in the previous lectures. They can have swelling of their mouth or tongue. They can have breathing difficulty as well, which can be quite serious. Or sometimes it can be very obvious, like a fang marks, which is indicative of a snake bite. So these are the most common symptoms of any bites, whether it's insect or reptiles, or it can be anything. So these is just a self-explanatory picture about what all the different types of marks or different types of presentation of various bites. So as I said, like certain bites like bed bugs and mosquitoes and certain flies, if they bite, these bites can be managed at home because it not necessarily that you need to go to the hospital. So what we can do at home is, one thing is, if there is like a bee sting, where you can see the stinger in the bite place, what you can do is try not to pluck it out, because sometimes accidentally you might break it and a part of the stinger may still be present underlying the skin, and it can spread the venom. So if you have a card like a debit card or any visiting card which is quite strong, you can just scrape it off. That will remove the entire part of the stinger. The next thing you can do is wash it with soap and water. That helps to prevent secondary infections. So that's a good thing. Try not to scrape it very aggressively. Gentle wash with soap and water should be more than enough. Then you can put some ice packs, as we shown in the previous lectures. Get an ice pack, put it on top of where the bite mark is. It will reduce the pain and it will prevent the further spread of venom as well. And then what you can do is, there are a lot of antihistamine tablets which are available. It's more like allergy tablets. The common names are, one is cetirizine or chlorpheniramine. But if you go to any medical shop or any supermarkets, if you ask them for antihistamines or allergy tablets, they'll be able to give it to you. So you can take one of those tablets and see how it responds to, because that will prevent the further itching and prevent further allergic reaction as well. So as I said, there are certain bites which cannot be managed at home, and this needs to be taken to the hospital as early as possible. One of them is scorpion bites. There are a lot of scorpions available. Some certain scorpions are non-poisonous. Certain scorpions are very poisonous that can instantly affect your heart as well, and can cause a regular heartbeat. So it's better you take them to hospital and being seen by a doctor. Like snake bites, which are very common in India, wasp sting, and certain tick bites can cause paralysis, which can eventually paralyze your arm and legs, can mimic like stroke. So we need to be aware of that as well. So these snakes, we call it the big four, because these are the quite common poisonous snakes which were available in India, as most of us are from India. So the one is cobra, which is very common. I'm sure most of you have seen cobra, either in movies or even in backyards and things. The other one is crate, which can cause it. Which can, if there is a crate bite, it can mimic something like a stroke and can cause paralysis as well. The other one is Russell's viper and saw scale viper. So these are called as the big four. So why is snakebite more important? As per the WHO, there are almost 5.4 million snake bites estimated a year, and out of which almost 1 million people die, and remaining 4 million people are left with some form of disability. Either they or end up with something like stroke or weakness of the hands, or they end up with permanent dialysis that needs to be done on a regular basis because of kidney failure and all those things. So how does it affect? When a snake bites, it can affect mainly three systems. As I said, if it's a crate bite, it can affect your nervous system, which is the brain, and can damage your brain cells, can decrease your level of consciousness, and eventually go into a state of coma. So whereas if there is like a cobra bite or a viper bite, these snakes specifically release toxins or venom which affects the blood cells. So that can result in bleeding either internally or externally. They can have bleeding from their nose. They can have bleeding from any of their from mouth or any of their oral cavity or any of their orifices, or they can bleed internally in their lungs. They can bleed internally into their bowels, or they can sometimes bleed into the brain as well. And sometimes it can affect your muscular system, like your muscles, and cause paralysis as well. So what to do when if there's a snake bite? So the first thing you do is try to take the victim away from the snake, because a snake, if they are threatened, they become very agitated. If you try to provoke it, they tend to bite multiple people as well. But usually the first bite is more poisonous. The second, third, subsequent bites will be more of a dry bite, will not have much of venom. So try to take the victim away from the snake. That is one thing. If they are wearing any tight clothes or any rings or anything, jewelry or anything, try to remove it, because that can decrease the blood supply further and can cause decreased blood supply. And third thing is you can wash it with soap and water, the bitten area, whatever it is. And then what you can do is you can put a splint, as shown in previous teachings. You can put a splint under the site of bite to prevent it from moving, which will decrease the pain. And what you can do is always keep the site of bite below the heart level. This prevents the spread of venom or toxins into the blood system. So that is one thing you can do before taking them to the hospital. And always take them to the hospital to be checked by a doctor, because there are some anti-venom or anti-snake venom that can be given within the particular time. If given within the particular time, can reverse it. So what you shouldn't do is try not to catch the snake. So when I say this, I myself have seen one of a patient when I was working in Madurai in one of the emergency departments, where a person was brought to the hospital who was bitten by a snake. He was actually brought by one of his friend who tried to catch the snake. He put it in a plastic bag. When he tried to peek into the plastic bag to find out what type of snake it is, it actually bit him on his nose. So there were actually two patients who was brought in. So this thing. So try not to snake the snake. What you can do is you can, if possible, from a safe distance, you can take a picture of the snake to show it to the doctor, so that they will get an idea about what type of snake it is, and they can decide how much of antivenom needs to be given for the patient, and what type of treatment is needed. So, and another myth going around is trying to suck out the poison. It doesn't help. I think it's shown in most of the olden movies that the people try to suck the poison and bring it out. It doesn't help. The poison always moves forwards, and it's not as easy like sucking it through a straw. So try not to do that. It doesn't help in any way. Third is applying turmeric and certain vinegar, soda bicarbonate. It doesn't help in any way. It doesn't, because the poison, once it has gone into the skin, it spreads to the deeper tissue and it goes to the blood vessels and affects other parts of the body. So whatever turmeric or whatever you apply on top, it's only for the skin, not for the underlying tissues or to the deeper organs. So try not to do any of those. Try not to apply any of those things, and try to avoid caffeine. in general, they say caffeine and alcohol should be avoided because what happens is caffeine is nothing but coffee. So caffeine tends to increase your heartbeat and increase the spread of infection. So try to avoid caffeine. So that's another thing I wanted to say. And you can try not to apply target, because by applying target, people think that we will prevent the spread of infection into the blood system. But if you try to apply tourniquet very tightly, what happens is it will decrease, as I said, it will decrease the blood supply to the that part of the leg or hand, whichever where the bite is, and it will cause further worsening. So try not to apply too tightly or anything. So that's just about snake bite. Next, about scorpion and wasps. There are certain scorpions and wasps which can be very dangerous. What happens is these bites can instantly increase the heart rate and cause irregular heartbeat and decrease your blood pressure as well. So make sure you take them to the hospital, being seen by the doctor, apart from your initial first aid remedies. And if needed, they'll give some medication to stabilize the heart rate. So because wasp stings can be quite dangerous. I've seen a patient while I was in Madurai who was brought after a wasp sting. He actually presented with signs of heart attack. So these things can happen. Sometimes it can be as simple as just redness or swelling. Sometimes it can be very serious, presenting like a stroke, or they can present this with signs of heart attack as well. So make sure you take them to the hospital. Again, a simple difference about wasps and bee. So wasps, they tend to have a longer body and the smoother skin. Bees, they have a lot of hairs, you can see, and they tend to have a shorter body. This is a simple difference. But when in doubt, always take them to the hospital. So again, another thing which is quite common, especially in India, is dog bites, because most of the dogs are stray dogs. Here in the UK, almost, 100% of the dogs are all vaccinated. Whereas in India, most of the dogs are not vaccinated because they tend to have this rabid features. So when they bite, it can ultimately lead to something called paralysis at a later stage, and they can die. So if you were bitten by a dog, apart from washing with soap and water, take them to the hospital, because the doctors will give an anti-rabies vaccine. It has a specific schedule which has to be given on the day of bite, and then after 3 days, 7 days, 14 days, and 20 days, like that. So it has to be decided by the doctor. If the wound is very bigger, or if there is a chunk of tissue that has gone out after a dog bite, they might have to put stitches on it, and they may have to give some antibiotics to prevent for the spread of infection. So here in the UK, they don't use anti-rabies vaccine at all, because almost all the dogs are vaccinated. So they don't tend to use any of those. So the second topic is about household poisons, which is quite common. So, so in general, a poison is any substance that causes damage to our health or can endanger our life. So it doesn't mean it has to be a liquid or a household poison. It can be even plants, it can be even food, or it can be anything. It's just even smoke inhalation can be poisonous as well. So the simple depends on what the site or mode of exposure is. Sometimes if you have taken it orally, like ingested it, you can have vomiting, you can have stomach cramps, pain. Sometimes you can have diarrhea and vomiting. And if it's inhaled, like smoke inhalation, whereas in burns, you can have dizziness, you can have confusion, you can have headache. Sometimes you can throw up a seizure, like fits, and go into coma as well. And if there's a skin contact, it can cause burns, which we have dealt in the previous classes. So the next one is about a poison. So this is one other common thing which we tend to use, axe oil. So it's mainly used for all the sprains, headache, backache, and arthritis. These axe oils, people tend to inhale it. If it is inhaled with a significant amount, or if it's ingested by mistake, it can cause confusion, it can cause seizures as well. So be cautious about it. Another thing is all those bleach and toilet cleaners, which if ingested, either for suicidal intention or accidental ingestion, especially by the kids thinking it is some form of juice or anything, what happens is that tends to cause ulcer in your food pipe, and it can be very dangerous as well. It can even cause a hole in your food pipe as well. So these poisons needs to be seen in the hospital at the earliest. Third is mosquito coil, which is quite common in India. Mosquito coil, if ingested or if after using it, if you don't wash the hands properly and you by mistake, if you put hands in your mouth, it can be poisonous as well. It can cause fits and seizures sometimes. There are a lot of cases reported of these coils ingestion or accidental ingestion causing seizures. One other thing is ratol, which is a rat killer paste, which is very common in, especially in my place. I come from Tanjavur, where there are a lot of farmers, because they tend to use rat killer paste. By mistake, they might have taken it as toothpaste and ingested it, because this rat killer paste can instantly affect your liver and cause significant liver cell failure. I've seen people who have ended up having liver transplantation because of this rat killer paste. One other thing is polypharmacy, which is quite common in the elderly age group, where they tend to have, by mistake, if they have taken too many tablets. So suppose if they are taking a tablet for a blood pressure and one for something for the heart and one for diabetes, and if they tend by mistake they've taken all three tablets, or if they've taken two tablets of blood pressure medication instead of one, it can significantly affect the heart rate and decrease the blood pressure as well. So that is another form of poison, which is quite common. And one other thing is kerosene. Kerosene inhalation is quite dangerous. I'll tell about kerosene in detail in the next slide. So this is one case which was reported in UK last year. A woman died after accidentally brushing her teeth with a rat poison, thinking it's a toothpaste. So it can happen. So be more cautious about it. So most of these poisons, as per the government rule, they need to put the antidote in the bottle itself. And you can, if you see the pack or the bottle closely, you can see what type of poison it is and what can be done in case of emergency if accidentally ingested or exposed to skin. So, and if you see this bottle clearly, it's clearly mentioned about the antidote, what needs to be done. And at the bottom, it clearly says, call the physician. So that means you need to go to the hospital to be checked by a doctor. That is one other important thing. Food poisons. I don't want to tell about food poisons in detail, just to make you aware that there are certain mushrooms that can be very poisonous. They can instantly affect your heart as well. The people tend to pluck these mushrooms thinking these are edible mushrooms. They tend to cook and eat it, and they end up with poisoning, food poisoning. They come up with diarrhea, vomiting, increased heart rate, decrease in blood pressure, and all those things. So one other thing is datura, which is common in India. All the entire plant is poisonous. The seed, the flower, the leaf, everything is poisonous. So be cautious about it. And reheating food again and again, especially fried rice, when you reheat it like two times, three times, so that can produce some amount of bacteria, like typically call it Bacillus cereus in medical terms, that can be poison as well. That can result in food poisoning. So yeah, I would like to add about button batteries, which are quite common in children. The problem with button batteries, all these lithium cells are magnetic. So if by mistake, if they have ingested one or two of these lithium batteries, what happens is as it goes along the food pipe, what happens is it tends to erode because of this acidic nature. It tends to erode the bowels and cause a leak in it, and that can be significantly dangerous. And what happens if they have ingested two of these? What happens is one gets caught in one of the bowel loop, and the other gets caught in another bowel loop. And if they come into contact, they get stuck together and easily make a hole in the bowel. It is quite dangerous. This needs to be seen in the hospital by the surgeons in emergency. And if needed, they will do either an endoscopy, like putting a tube down through the mouth, and they'll try to take it out. Or if it's deep down, they have to do a surgery and take it out. Another one is coin, where kids can accidentally ingest a coin. So what happens with the coin ingestion is as gets ingested by mistake, it can either go through your windpipe or it can go through your foot pipe. So the problem with this, if it goes through the windpipe, it can get obstructed anywhere. It goes down, down, it becomes more and more narrower. It can get obstructed. They can have significant breathing difficulty. So that is a medical emergency. So if it goes through the foot pipe, obviously the doctor will do an X-ray and see where it is. If the coin is below the level of the stomach, what they do is it usually doesn't cause any problem. They tend to come out through the stools through excretion. But if it's above the stomach, what they will have to do is they will have to do an endoscopy assay. They'll have to put a tube through the mouth and suck it out. So it needs to be seen by the doctor to find out where it is, whether it is in the windpipe or in the foot pipe, and decide the treatment regarding that. So always take them to the hospital. It's an emergency. And kerosene is one other thing. The problem with kerosene is highly volatile, so it can evaporate easily. So if ingested accidentally, what happens is even if it has gone into your stomach, one, it can cause ulcer in your stomach or along the foot pipe and can cause a hole in it. Other problem is even if it is ingested, it's in the stomach, because of its evaporating nature, volatile nature, it can go up and go into the windpipe as well and cause like a pneumonia, pneumonitis like picture, and affect the lung. So this is quite dangerous, and this cannot be managed at home. This needs to be seen in the hospital and treated accordingly. I've seen one of the kid while I was in Tanjavur who was brought by his dad with accidental ingestion of kerosene. He said it was just few mils, like 3 or 4 mils of kerosene. So I insisted him to get admitted to the hospital because of the nature of kerosene and the chances of further infection. He refused. He refused treatment and everything. He took the child back home and eventually came in after 4 hours with significant breathing difficulty and signs of chemical pneumonitis. So you need to be generally aware of kerosene. It is quite dangerous because we tend to use kerosene. Kerosene is very common at homes, especially in India. So as I said about polypharmacy, taking multiple tablets or taking the same tablets, more number of same tablets can cause significant problem. Again, it depends on the tablet. Certain tablets may not cause, if it's just a pain medication like simple paracetamol, taking 2 tablets or 3 tablets of paracetamol would not cause any issue. But in case if you have taken multiple sleep tablets, thinking that one is sleep tablet and one is something else, you can become drowsy and you can eventually go in a coma state for a while. So you need to be very cautious about it, especially in the elderly age group. And again, kids tend to accidentally ingest medicines either of their parents or their grandparents, thinking it's a candy. So what happens is most of these tablets are tasteless and they're odorless. So kids may not have actually ingested the entire tablet. They would have tasted and they would have spit it. So make sure you check the bottle and see if the number of tablets or the strip of the number of tablets are still there. And if the kids are asymptomatic, you can observe them for a while. At least generally we recommend 6 hours. If they develop any symptoms of like persistent vomiting or loose stools, or if they have any signs of breathing difficulty or becoming more and more drowsy, please take them to the hospital to be checked by a doctor, or if not, they can be managed at home as well. Yeah, this is one thing, carbon monoxide poisoning. One is, it's very common after burns or like there's a significant smoke, or it is quite common in the UK because UK, every place has a heater at home. So what happens is if the heater is kept off for a long time during summer period and suddenly you turn it on during the winter period, it tends to excrete a lot of carbon monoxide, which is quite poisonous. The problem with carbon monoxide is the gas doesn't have a smell. You can't see it and you can't hear the sound or the sound of the gas coming out. So what you can do is ideally install a carbon monoxide detector and see what the level of carbon monoxide is. So carbon monoxide is quite lethal because what happens is it can cause confusion, it can cause headache, it can cause dizziness, and it can cause seizures, and they eventually can go into coma as well. So if they have any of these signs, please take them to the hospital. And they need to monitor the carbon monoxide level and give an adequate oxygen to remove the carbon monoxide. So always take them to the hospital. Seek, if in doubt, always seek medical help at the earliest. So what we can do before taking them to the hospital if you think someone has ingested or taken poisoning. So what you can do is, if there is anything obvious in the mouth, if you can see any tablets or any liquid or anything in the mouth, you can remove it. You can ask them to rinse the mouth to bring out whatever is left over. Try not to give anything to induce vomiting, because it's quite common that people tend to give salt water and use certain syrups like ipecac syrups to bring to induce vomiting. The problem with that is it will result in severe retching, and sometimes all this vomiters can get aspirated. They can go into the windpipe and get they can have secondary lung infection as well. So try not to vomit it. What you can do is you can take them to the hospital at the earliest, if possible, within the first hour. And if there are these poisons can be taken out, the doctors tend to put a tube down the throat and give a stomach wash to bring out whatever is left over in the stomach. Other thing is, if it's a skin contact or if there is a contaminated clothing, remove the entire clothing and take a shower, or rinse whichever part is affected, at least for 10 minutes, just with normal running water. That should be enough. And if it's an accidental exposure to the ice, you can gently flush with cool water for at least for 10 minutes. And then if you still have the symptoms like blurring or watering continuously, you can go to the hospital and get it checked by an eye doctor. So what happens when you go to the hospital? In case if they are taken hospital within the first hour, especially the first hour, stomach wash can be given by putting a tube, and there are certain poisons that can be taken out at the earliest and can prevent the further spread of symptoms. And most of the poison needs to be observed at least for a period of 6 hours. And if they don't have any symptoms for 6 hours, they can be discharged safely with warning signs explained to the victims. So what you shouldn't do is do not induce vomiting. As I said, that can result in significant aspiration. And if in doubt, don't delay in treatment. And if they're symptomatic, please take them to the hospital at the earliest. So yeah, these are some of the first aid manual books, which are mainly available for laymen and public. There's one for adults and one for kids. You can buy it online. It's available in Amazon and eBay, which is quite helpful actually. It will give you a brief idea about what to do before taking them to the hospital. Again, the whole point of this lecture is to give you an idea about what to do in case of an emergency. This is not 100% cure. When in doubt, always take them to the hospital. I hope this shouldn't happen to any of us. May Allah protect us. That's it from my side, Nabil. Thank you.
Barakallah fiqh, Jazakallah khair for the lecture. Alhamdulillah. I think that would have been really useful for a lot of people. That brought a lot of memory to me about a lot of things that we've seen over the years. Same like Noordin, I've seen a lot of snake bites, happening in and around Kerala and other places we used to work. People used to just bring the snakes, and I think you've done a very good job of explaining what are the common things that we experience and what people should do and shouldn't do. Anything related to bee sting, as Dr. Noordin explained, if it leads to anaphylaxis, we have a lecture on anaphylaxis in the previous sessions. We can refer back to that. Coming to dog and those things, there were a few questions on dog saliva. Rabies, the most well-known rabies we know is of the dog bite. Okay, but however, remember that the rabies can be spread by other animals as well, like bats and some places like raccoons, which we don't have commonly in India and other places. But bats are also well known to spread rabies, and that's one of the wisdom that the Prophet ﷺ mentioned to us for washing the vessel on which a dog licks. Okay, with 7 times, wash it for 7 times. In the first time with earth, and then followed by 6 times with water. So the final point I wanted to talk about was about the kids, and this very important thing that over the years, all of us have seen plenty of poisoning, okay, accidental poisoning, and foreign body ingestion by kids. Guess what? Okay, the important thing I wanted to say was kids are not responsible when they do that. Okay, because they're not. I'm talking really small kids. Okay, the mistake is on the carers. The mistake is on the parent who has left the child unattended, okay, near an object or near a liquid or near a substance that can potentially kill them. And with experience, we have seen such incidences in the past where parents break down completely, okay, when they eventually see that their child is harmed to that level that some of them end up in ICU or some of them even die. Okay, we have seen children who ingested batteries. Okay, and like the button battery, which I'm talking about this, which Dr. Nudin showed. And the button battery, if it stays in your food pipe for a certain number of hours, it can lead to very bad outcomes. In certain cases, it has even caused someone to bleed out to death. Okay, so it's very important that you do not have those small objects like button batteries, okay, laying around in easy reach for a child. Keep them very high, keep them away, keep it really away from them. In my personal opinion, do not keep anything small that a child can ingest, okay, in their reach. To a certain age, when like 3-4 years, that they're going to be in that age group where they will put anything in the mouth. So keep it away from them. And also this bathroom liquids, whatever it is, Harpic or all those bathroom liquids which are really corrosive, okay, do not keep it in their reach. They can swallow and can cause lots of problems. So that would be our advice. Barakallah fiqh. What I will do now is I will just show the plan for the next class. Then we'll go to question answer, inshallah. So the next class will be our last class, inshallah. That will be on the November 29th. We will be discussing the quiz. So I will be sending out, inshallah, a quiz. Okay, that will be the final quiz. And we will discuss the answers for that next class. We'll demonstrate the BLS and BTLS again in a complete manner. The whole of it will be shown in a full manner so you can revise the whole. We will do it in a case-based discussion. So I will provide a case. We can either combine it with the quiz session, okay, and make it as a demo in the same time, okay, discussing those questions, because those questions will be, inshallah, a clinical scenario, a scenario where you'll actually what to do if you encounter such situations. We will demonstrate it, and then we will tell you what else you can do after this class. Once you finish this course, how can you proceed, what more you can do in first aid, what you can learn, how you can get certified. Inshallah, we'll talk about that. Then those who finish the quiz, we will ask them to put their name in the quiz itself. There will be a section to put your name, and that name will be included in a certificate. When you complete the quiz, those who complete the quiz will get the certificate, inshallah, of attending this course. And after that, we'll close, inshallah. And also, we would like to know if there is anything else you would want us to cover, we can cover in the next class. So keep, providing your inputs. Tell us if something we've missed that you want to learn, some emergency that we've missed. Then tell us about it in the WhatsApp, Google Classroom, or email to us, okay, or Rikak, or even you can mention today's Q&A, or you can put in the chat box today. We will keep a note of it and we'll try to, help out, inshallah, next class. So let's go to some question answers now. So Dr. Zishan and Dr. Nudin, are you on now? Okay, you can unmute yourself.
Yeah.
Yeah. Okay. So let me just go to the chat 1 second. I've already got some questions. I can start with Dr. Zishan, because this topic was first. There was a question on, on heat stroke. Someone asked that, can we take a bath for those who experience such symptoms, heat stroke, okay, right after the heat stroke? And what happens if someone becomes unconscious?
Sorry, can you repeat that again?
So the question was, someone asked, if is a bath recommended by someone who's had a heat stroke?
Well, so if you have had a heat stroke, that means it's an emergency. That means your body has become so unstable because of the heat. It needs very effective cooling, and it probably needs a hospitalization. All right, that is heat stroke. All right, just giving a bath alone at that point will not be helpful. Okay, they need to be taken to the hospital. They'll put IV lines. They'll do more effective ways of cooling. But before heat stroke, there's heat exhaustion, where the person is beginning to feel hot, tired, sweating too much, very dizzy. Then you can take them. A bath means cold water bath. Yes, you can give. But remember, what gives you a clue that this is heat stroke is after all this giving a cold bath, you do everything, and they're still not becoming better. They're getting worse. At that point of time, your whatever you do will not be effective. They should be taken to the hospital at that point of time.
Yeah, and also what happens when someone becomes unconscious with a heat stroke?
So remember, if someone gets unconscious with a heat stroke, that means the brain has reached that tipping point. That's why it has shut off. That doesn't mean they're dead yet. And remember, unconscious person go through the same algorithm, see if they are awake, see if they're breathing. If they're breathing, put them on the side recovery and take them to the hospital. All right. If they're unconscious because of excess heat, give them take off their shirt, clothes that are too hot, put some cold water on their forehead, armpits, neck, and put them on the sides and take them to the hospital. All right. Don't just leave them like that because then don't think that after excess heat stroke, then they'll come out by themselves. No, they should go to the hospital after that.
Okay.
You don't need to do CPR because they don't have cardiac arrest.
Yeah. Great. So, Dr. Nudin, there was a question on bee sting, and can we use baking soda for a bee sting?
For a bee sting?
Yeah.
No, it's generally not recommended to apply baking soda for a bee sting. They can
Okay.
have, so what happens with the bee sting is they tend to have significant itching, swelling, and pain. So what you can do is you can take some antihistamines, as I told, that will decrease the itching, and you can take some painkillers, either either ibuprofen or paracetamol, that will help in relieving the pain. So baking soda will not help much. So I wouldn't
Okay.
recommend that.
Fine. And what about there is a good question on burns. You mentioned about carbon monoxide. What are the sources of carbon monoxide?
So in general, obviously in India, we don't tend to use much of heaters. So it's obviously from a place where there are a lot of burns or some accident and a lot of smoke coming out. So that can be a potential source of carbon monoxide. Or it can come out of all this vehicle smoke and all those things. That can be a source of carbon
Yeah.
monoxide. And in
True.
UK, it's mainly the heaters, indoor heaters, that is the main source of carbon monoxide.
Yeah.
So again, if the symptoms if they have any symptoms of carbon monoxide poisoning, like dizziness, headache, confusion, that
Yeah.
they need to be seen at the hospital.
True. Dr. Zishan.
Yeah.
So I think there was a very important question. I think it's a very important question that someone asked, that if a child who has had seizure is cured completely, okay, and I assume that they're saying that he's known to have seizures, should he be left alone in a bathtub or a beach area?
So for this, it should have been confirmed. Is it really confirmed that the child has come out of his seizures? That's what people should know first. So for that, it should be the neurologist who gives the clearance. All right, you have to take the child to a neurologist and ask them, does he need to take seizure medicine anymore? Has he come out of this now? And then you can ask them, is he safe to go do high risk activities by himself? Like, bike driving or climbing or swimming by himself. If the neurologist says okay, then that's fine. But personally, I would just say that, just, if the child has come out of it, it's well and good. But always keep that in mind that, okay, it's better that I always have someone to look out for him, even if he's alone swimming. Just keep that in mind.
True.
Not every
Very
time,
true. Yeah.
but just keep that in mind. That's what.
I mean,
If it's
and here
confirmed,
in
yeah.
absolutely, yeah. That's very important point, that you have to confirm if he's had a seizure. I mean, if it's a known condition. But in general, here in UK, they have a rule that someone's had a seizure, you do not let them to drive by themselves unless it's confirmed that they have a condition of seizure for a few months. So it's right that you should it's safer to not to drive, not to be in a beach area or a tub by themselves. That'll be a safer option. Yeah. And Dr. Nudin, there was a question about the home food and nausea. If someone is just experiencing some nausea and vomiting, what is
Okay.
that? How can we prevent, and what should we do after eating a bad food? It's possibly food poisoning, I think.
Okay, so it depends. Like if everyone at home has got the same symptoms, it can be food poisoning. So if just one person has got the symptoms, not necessarily it can be food poisoning. It can be secondary to indigestion or it can be anything. So what I would suggest is if they have any previous history of gastric ulcer or indigestion, maybe you can take some antacids. And there are a lot of like anti-vomiting medications that are available as well. If they seem to be fine, they can take some oral rehydration solutions just to keep them hydrated, which is available over the counter, like with various names like Electrol, Altrobion, and all those things, and should be okay. Just observe for a few hours and see how they're doing. If the symptoms are persistently there, like continuously vomiting, not able to eat and drink, and if they appear dehydrated, like drowsy and headache, maybe they indicate some form of fluids that can be given through the veins, so they have to go to the hospital in that case.
Okay. Fine. And I think that you mentioned about Axoil in between, and someone was asking about Axoil. What is the harm with an Axoil? It's very commonly
So the
used in
problem
India, I
with
think.
Yeah. So it's mainly Axoil ingestion can cause significant problems. It can actually throw up a seizure. It can cause drowsiness. There are cases reported because of Axoil ingestion, even naphthalene injection. They are all typically the same. All these can cause seizures and fits as well. So if taken in small amount, that's fine. Like just inhalation, like we use applying over the forehead and all those things, that's acceptable. Now I'm saying if it in significant amount, that can cause all these problems.
Okay. Great. Dr. Seshan, there was a question on your superficial blisters during a frostbite. And someone's asking, is it normally formed when you rewarm? When you rewarm, are there any damage that's done to the skin?
So superficial frostbite occurs during, will blisters form on rewarming the leaf? No, it's sign of the stage. It's a sign of the frostbite. It doesn't happen because of rewarming.
Okay.
In the second stage of frostbite, when your fingers are getting, your skin is getting more and more frozen and damaged, that time blisters will form. Rewarming means the blood flow is coming back to those areas and they'll start improving. I think the person is asking because when someone gets a burn, that time also there's blister formed. See, both are similar things. In burns, also your skin is getting damaged. In frostbite, also skin is getting damaged. When that skin damage gets worse, there will be blister formation.
Okay.
Blisters will go away once they're broken off. The water will come out. They will heal by themselves eventually. But that is still the stage where you can heal and bring them back. So this can happen in frostbite, but that's still a stage where you can bring the skin back again. Rewarming takes slow time, but those things will go away eventually. So
Okay.
I think I'll just ask another question. So I answered. Below that, there's another question. Someone says, if hospital is far, what do we do for heat stroke? So the person remove the person's hot clothing, shirt, or cap or scarf, whatever they're wearing. Keep putting cold air over them. Take a book or fan and keep putting cold air over their face. Keep putting cold water over them, ice pack near their forehead, and go to the hospital. All right, it's better they check in the hospital, do the blood test, and give them cold IV fluid rather than you staying at home. Even if your hospital is far, still I would say better do this thing and take them to the hospital rather than just staying at home.
Yep, very valid point. Yep. There was a general question. I think one was related to the topic I presented on tooth avulsion. So I think a person is asking about if the tooth is broken in between and it's not completely come out, it's partially broken. So I think you're talking about a tooth fracture. A tooth fracture, there is nothing much we can do right away about it. Okay, and that's not a dental emergency unless it goes through the root and up. If it's in between and you can see on the mirror that your tooth's broken half, okay, but it's not completely come out, you still have to go to the dentist anyway. But it's not going to change the management as such immediately. If you don't go in time, it's not going to make a big difference immediately. What the reason I told about a tooth coming out completely and putting it back in time is because it's time critical. If you go after many hours, that may not be a successful reimplantation. So that's why we spoke only about the tooth avulsion. Okay, so going back to some more questions. I think there was a question on dengue fever, but it's not exactly related to our topic, but because they thought it's mosquito bite. So can Dr. Nordin just give some brief guidelines on dengue fever? We're not exactly talking on the full scale of it now, but can we just give a brief idea about mosquito bite and dengue fever, how to prevent and how to deal with that?
Preventing a dengue fever or like symptoms?
I think just going back to the question, I'm not sure exactly what was their what they were trying to ask in that.
Mm.
So I'm just trying to go back to the question and see if there's anything.
I can
So
see
how do
the
we
same.
prevent
Yeah.
dengue fever that follows a mosquito bite, as it's very common in their place?
Okay, so mainly dengue fever is by mosquito. You know, everyone knows that. So it comes. So the places where dengue the mosquito breeds is mainly in stagnant water. So if especially in water that's been stored for a long time in the backyards, in pools, in like if there are any leftover car tires or anything at the backyard that can have some water after rain. So these mosquitoes can breathe there. So main uh, way to prevent is only one, you can use adequate repellents. You can use mosquito nets. You can use all those prevent water clogging or prevent all those saving like water for storing water for a long time in all those pots or buckets and all those things for a long time. That it's like the main prevention for dengue fever.
Okay, yeah. And there was a question on a child eating the scraps of the wall, okay, or some shoe polish. What can be done? Yeah, I mean it's child.
Eating scraps and shoe
Uh,
polish.
yeah, I
Okay.
think that the
Okay.
meaning that they're eating some probably
So
the
we should
paint
prevent that,
or
first of all. That's one thing.
yeah, yeah,
Yeah. So all
yeah.
these paints, shoe polish, and all those have petroleum products in it. So if ingested, maybe if there's a significant amount of ingestion, they can have chronic problems like anemia, or if it's they can have erosions, they can have gastric ulcers. As I said, all these petroleum products can cause any of this lethal problem. Sometimes they can throw up seizures also. Most of
Okay,
them will have chronic problems like anemia. The blood counts can go down on a long-term basis. They can have something like lead poisoning and all those things on a later basis.
exactly. Yeah, lead poisoning is important with paints and other things. Yeah.
Yeah, especially
There,
eating pencil,
yeah,
graphites, and all those things, which is very
yeah.
common.
There are a couple of few myths I think there's going on in the question answers. There've been people asking about, pigeon blood and soup and meat. Will it cure stroke patients? I mean, these are things which I don't think we need to answer in this thing. That it'll these are things which are not proven medically as such. Okay, to cure these things, and also about if drinking a papaya leaf juice, will it increase the platelet count? Okay. Allah knows best. Dr. Nudin, do you know anything? I think they are referring this to the dengue. I think will papaya leaf juice, will it increase? I don't know really if it does or not.
Yeah, it's the same. I have not come across any papers or any studies that shows that drinking papaya juice will increase the platelet account and platelet counts. But generally, what they suggest is hydration. Keep them hydrated, and that should be enough. And take adequate like paracetamol for the joint pain and body ache, and that should be the case.
Yeah. And I think there have been a lot of questions on electric shocks and lightning strikes. We did initially include it, but I think we removed it. We didn't want to go into details of it. Inshallah, we will try to put some slides on it next class, inshallah, on lightning strikes and electric shock. We can explain it now, but I don't want to take up the session on that now. It'll become prolonged if we start explaining it.
Nabil,
Um,
did you cover that question about heart attack and stroke myth? Hello?
yeah. About you mean the for stroke patients?
Yeah.
Yeah, I mentioned that, saying that
No, I mean the other one. If someone has a heart attack and you prick the fingertip.
tips of fingers with the pin to release pressure. No, that's again. These are just myths. There is no such thing. We've explained what happens when a heart attack happens and someone becomes unconscious. So the one other thing I wanted to mention with heart attack was, like, if you have someone elderly in your home who's experiencing a chest pain, probably the only thing you can do, okay, is help them, breathe better and just give them aspirin if you can. Okay, please If you have aspirin at home, soluble aspirin, that is the best thing you can give when someone's experiencing a heart attack. Anything other than that, don't try to prick the fingers or anything that has no proven effect. Other than that, there was a question on, I think there was a question on, yeah.
People talk about allergic reactions.
Yeah, generally about allergic reaction. I think it's all regarding bites and or touch to some allergens. So
it's common to have that. Some
yeah,
sisters saying that the hand, it happens to when they clean prawns. Maybe your skin is sensitive to the substance in prawns. Prawns. The other one is when someone touches cold water, ice in normal temperature. This happens again. Maybe your skin is just reactive to cold water. That can also be there. Other than that, that's what a person has allergy in winter, mainly at night. Yes, this also is. Maybe you have to look for hay fever. This also happens commonly. A lot of other interesting questions are there.
yeah. Aspirin was a good shot, and I think Nudin has put it in the chat box that you take 300 milligrams of aspirin. Okay, when you need it. If you have a 75 milligrams, take 4 of them. That should be enough.
Was it for me? Okay.
Oh no, I think no. He's already put the answer in the chat box of how much aspirin should someone take when they have an heart attack. Okay, I think I'm not really getting any more new questions at this point.
To see if you have missed out any questions.
Yeah, I'm just going over them. Haven't really come across any. There was a question on, I think, snake bite. But I think that was generally about, is there any other Islamic methods of treating it? Someone asked. But I think we won't be covering that in this session. Okay, and we are not experts on that. But however, we can tell that, yes, ruqya can be done on stings and bites, and it's been proven from the Sunnah. It's proven from the Hadith of the Prophet ﷺ that people should recite Surah Al-Fatiha. And other verses from the Quran, like Ayat al-Kursi, the last 2 verses of Surah Al-Baqarah, and many other verses, the last 3 surahs of the Quran. These are the main ayahs in the surah of the Quran which are used for ruqya. The important point I want to tell is, okay, yes, as Muslims, we should start off with that. Definitely, the cure is from Allah. Okay, and there's no harm if you're stung by a snake or a scorpion to place your hand on that part and make dua to Allah and to use the ruqya, like recite Surah Fatiha on it. Absolutely no problem. But at the same time, I would want to say that, it's a combination of both. We take we do make dua. At the same time, we also need to take the means to cure it. Okay, we have to go to the hospital as well at the same time. Okay, and eventually these are means which you're supposed to take as advice for the Prophet sallallahu alaihi wasallam. Okay, he asked us to take the means, okay, to cure ourselves, and eventual cure is from Allah Azza wa Jalla. I hope that clears that doubt. And Jazakallah khair, Dr. Zishan, for putting up the link for posters. So again, okay, this Dr. Nudin, are you there?
Yeah.
Yeah, I think people, this is the 3rd time someone is asking again. I think they're thinking that carbon monoxide is emitted from every heater in a winter. But can you just explain what are the ways to avoid that inhalation, how to detect it, and what can we do about carbon monoxide leak in people, those who are living in the cold places?
Yeah. So it's not emitted from every heater. So mostly heaters which are kept off for a long time, especially during summer, and suddenly you turn it on during winter, it can happen. Not necessarily that it should happen. The best way to, as I said, it doesn't have a smell. You can't hear it or you can't even see it. You can't even smell it as well. So the best way is to install a carbon monoxide detector. So all these new heaters which are coming up nowadays has got a carbon monoxide detector along with it. So you can regularly monitor it, or you can call the service person to check if the carbon monoxide levels are emitted at a normal level from the heaters. So the symptoms, as I said, if you think they are exposed to carbon monoxide and they have symptoms like headache, persistent headache, confusion, and dizziness, it's better to get checked at the hospital because we do a specific blood gas analysis to see if the carbon monoxide levels are normal.
Yeah, and also I think many of the houses here have carbon monoxide alarm. So they have an alarm which actually detects a device that detects the carbon monoxide and gives an alarm. So that is that's a requirement in most of the houses which have heaters. So
yeah.
Yeah.
बाहर
1 second.
बाहर नहीं है रे.
Zishan.
1 second. Dr. Zishan, 1 second. If you can
Sorry,
put yourself
my
in.
daughter.
No, that's okay. That's all right. No problem. Okay, I'm trying to see if there's anything else that we can answer. If not, we can summarize. Regarding aspirin, again, someone has mentioned that what if it's indigestion and they're giving them aspirin? The question is, we ourselves, as doctors, we ourselves don't know when it is indigestion and when it is heart attack completely at the first time itself. Okay, it's a very tricky thing. So don't assume that it's indigestion. When an elderly person has a chest pain, don't think it's indigestion and just leave them. And many people have lost their lives like that. So please take them, if it's a bad chest pain, please take them to the hospital. They will do ECG, they will do blood tests, they'll do other things to check if it is the pain is coming from the heart or is it from your stomach. Okay, that is very hard to say. Both those places, even if it's a gastritis or ulcer in the stomach, that can give a similar presentation like heart attack, okay, in the chest pain, with the chest pain. So don't assume it. No harm if you give aspirin, even they're having a trouble from the tummy. It's safer rather than not giving.
Yeah, exactly. Yeah.
Fine. I think there is allergy and stuff we have covered. And inshallah, if you want more topics and other things, please put the messages, topics you need in the Google Classroom and in WhatsApp groups. And, you can even email. We will talk about it, inshallah. The other thing is about the quiz. There were a lot of questions on the quiz. The quiz details, inshallah, we will tell about it soon in the groups. Okay. There isn't any passing mark that we have set, but we would like all of you to be truthfully taking the quiz. Okay, with after seeing the videos, after seeing the PPTs, just go over them once and then take the quiz and put your name on it properly. That same name which you put on the form will be the name which will be used in the certificate. So if you want the certificate for the course, okay, you will have to answer the quiz. But we haven't set a passing mark or anything. We will discuss and inshallah the answers in the next class. And it's for you to self-evaluate yourself and learn from it. Okay, but do your best to answer it properly. And we will, once the quiz is ready, we will roll it out in the groups, inshallah. Fine. I think that should be enough. Is there anything else that we're missing? Dr. Zishan, Dr. Nordin, you can add. Is there anything else, or we can end the session, inshallah?
Yeah, I think there's no more questions that needs to be answered. There's a question about how to join WhatsApp group, and yeah, that's the only thing by one of the brother.
Okay, all right. Yeah, I think you can message, no problem, sure. All right. Fine, with this will end the class. Subhanakallah bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.